Good morning, good morning, good morning, mga followers, mga subscribers. Gandang umaga. Yung pagbabasahin natin ngayon is yung breast cancer. It's all about breast cancer. Breast cancer. Even though the numbers of cases of breast cancer diagnosed has increased, the chance of a woman developing breast cancer is 1 in 8. The death rate from it has declined. This is primarily due to early detection and treatment. Women are now much more aware of checking their breast regularly for early warning signs, and routine mammograms for women over 50 or whose chances are greater than usual or developing breast cancer has meant that many more women are now surviving cancer, often without having to resort to mastectomy. Mastectomy. What days it is known as breast removal. Risk factors. While anyone is open to the possibility of developing breast cancer, some women are at greater risk than others. It is used to be believed, for example, that only women over 40 got breast cancer, while sadly, even women in their 20s can develop cancerous tumors. You are in a low risk group if you are under 40. So are women who have had an artificial menopause induced by period blocking drugs. Factors that can statistically increase your risk of breast cancer include a history of breast or ovarian cancer in the family, particularly your mother or a sister, being over being over 40. High estrogen levels. Contraceptive pills are no longer normally high estrogen but check HRT or any other hormonal treatments. Starting periods early or menopause late. History of benign breast disease. Childlessness. Being overweight after the menopause. Some of these are obviously higher risk indicators than others. If you fall into a high risk category, it is advisable to go for 6 monthly breast examinations and ask your doctor's advice about seeing a specialist. Warning signs. Around 90% of breast lump are detected by women themselves, while routine mammograms and examination by a physician frequently pick up an early sign. Not all of the following symptoms indicate cancer, but they should always be checked out straight away. Appearance of any hard lump on the side of the breast, in the armpit, or in the neck region. Breast pain, nipple discharge, inversion or retraction of nipples, ulcers on the skin in the breast, neck or armpit area, enlargement of one breast, resulting in abnormal lopsidedness, any unusual hardness, a change in shape, particularly any sort of dip or local shrinkage, an area of redness or flushed skin. In the early stage, the abnormal cancerous cells form a small lump, 2 cm or less across, which can be moved around. Left untreated, the lump grows in size and will become attached to the chest wall so that it is no longer mobile. It can also affect the skin in the form of ulcers. Further checks. Your doctor will arrange any suspect lump or abnormality to be investigated further with a mammogram and or a biopsy. A mammogram, which is a type of X-ray, gives a clearer image of a lump or abnormal tissue than manual examination can do. But a biopsy is more accurate method of diagnosis. This involves removing a small part of the suspected tissue under local anesthetic. On diagnosis, like all cancers, breast cancer is graded according to the stage and integrity of the tumor, and treatment will depend on the results of further tests to check on the aggressiveness of its growth and its spread. Early diagnosis and treatment can make all the difference. One important step is to establish whether the tumor cells are receptive to estrogen or progesterone. That is, they seem to grow rapidly when the level of these hormones in blood is high. If they are, then drugs to block these hormones can often successfully contain or suppress the growth of the cells. This gives a positive prognosis. Significance of lymph nodes. Rather like the blood circulation system, the lymph network runs all over your body. It is fed by glands or nodes, and one of the areas of concentration of this is close to the breast, cluster in and around the armpit and up towards the neck. If cancerous cells in the breast reach the lymph nodes, the worry is that the lymph system will provide the means for them to spread more rapidly to other areas of the body. This is why, as well as any lump in the breast itself, you should be alert to the appearance of any telltale lumps in the area of your armpit or neck. They will be small, hard, and round, unable to be moved around. Tomorrow, yun na naman yung continue naman tayo sa pagbabasa. So, for today, yun lang muna. And hopefully, meron kayong natutunan sa araw na to. Till the next day. Bye-bye. God bless everyone. Take care of yourself always. Mwah.